Hello, I'm Bill Fitzgerald, President of the Board of Directors of the Rhode Island Free Clinic. It is my honor to introduce to you our new CEO, Forrest Daniels. Forrest is board certified in healthcare management, a fellow of the American College of Healthcare Executives, and a recipient of the ACHE Chairman's Service Award for his contributions to healthcare management excellence. Forrest has dedicated his career to the most vulnerable patients, serving in senior management roles in hospitals, community health centers, and community organizations. We're truly fortunate to have him leading our team, and I would like you all to hear directly from Forrest about his vision for the Rhode Island Free Clinic and why the clinic is so important to thousands of Rhode Islanders.
Throughout my healthcare career, I've been focused on the medically underserved, working poor, and uninsured. And it really resonates with who I am as an individual, and really something that I'm very deeply committed to. It's part of my DNA, as they say. The clinic represents that, the patients we serve, and it's just an honor to be here and provide that leadership and support to the staff and to the patients. The Rhode Island Free Clinic is very important to the healthcare infrastructure in the state of Rhode Island. It's been referred to as the gem in the state. We provide comprehensive, quality primary care to individuals that hopefully will prevent them from having to go to the emergency departments, which is found to be more costly. When they come to us, we can provide more continuity of care. Research suggests that for those who are uninsured, they are highly unlikely to seek preventive medical services. The mission of the Rhode Island Free Clinic is to provide culturally competent, quality primary, dental, and behavioral health care to our patients. In addition, we also are a training site for aspiring healthcare professionals, which also complements the needs that the patients have outside of just receiving medical services. By being here, patients can come to us and not have to worry about fear of making a choice between the medical services or paying rent or getting food. We want to support the whole notion of social determinants of health. So if they need assistance for rent, if they need assistance on transportation, things of that sort, we want to be there to support them. As recently as the latter part of last year, there was a partnership that was formalized where we now have a volunteer medical provider who is part-time here at the Rhode Island Free Clinic that is being supported by Brown Medicine. That is tremendously significant because it provides additional stability to administrative aspects relative to clinical leadership. So Brown has stepped up, they've been very supportive, and it's to benefit our patients. Some of the physicians that come to the Rhode Island Free Clinic are among the best in their professions. They are committed to providing exceptional quality care to our patients. We are very fortunate that they give of their time aside from their day jobs. And so what happens when individuals come into the Rhode Island Free Clinic, it's really an element of love because persons give of themselves in ways that you don't often see, but then they're also providing love with compassion and exceptional quality care. So an individual, a patient who comes into us might feel disappointed or distraught because they happen to come to the Rhode Island Free Clinic because they don't have insurance. But by the time they leave, they're gonna leave feeling more empowered, they're gonna feel valued, they're gonna feel worthy, they're gonna feel better health-wise, and hopefully that will translate into how they relate to their family members and themselves going forward. The spirit of the Rhode Island Free Clinic is such that it really, again, provides that very unique, loving environment that is supportive of the patients when they come in.
It's a little strange watching a video of yourself, but I'm glad Bill told you more about me rather than having to do it myself. Tonight, as the new CEO of Rhode Island Free Clinic, I'm honored to serve as Master of Ceremonies for our 2022 Virtual Founders Event. I would like to thank each of you for tuning in tonight. Tonight, we're celebrating our amazing volunteers and community partners who help Rhode Island Free Clinic provide free, comprehensive primary and preventive health care to uninsured and low-income adults. We start off our program by announcing this year's Founders Award recipient. Rhode Island Free Clinic depends on resources within the local community to help maintain our free medical care for those in need, the most vulnerable in our community. Our partners include statewide corporations and foundations, as well as healthcare, academic, and community service organizations. Together, we provide culturally competent, quality, expert medical care free prescriptions, and meaningful hands-on training to emerging medical professionals. This year's Founders Award goes to Brown Medicine for their inspiring commitment to healthcare access, equity, leadership, and their extraordinary long-term partnership with our clinic. I'd like to introduce to you the president of Brown Medicine, Dr. Lou Rice. His leadership has inspired many of Brown Medicine's physicians to not only volunteer at the clinic, but to also be involved in the medical management.
We have a three-pronged mission at Brown Medicine. First and foremost is clinical care. Our next mission is to educate the next group of providers, physicians, advanced practice professionals, and many people in the medical area who will be caring for the state far into the future. Our third mission is to do groundbreaking research. And Brown Medicine does research all the way from the deepest molecular biology to clinical research that has implications around the world. The support that we offer the Rhode Island Free Clinic evolved basically from an evening conversation between myself and Carolyn Troisi. Carolyn has been the medical director of the Free Clinic about for the last 20 years. Carolyn asked me, was there something that Brown Medicine could do to offer some level of succession for those duties? And I thought, Brown Medicine should. We really should be involved with the Rhode Island Free Clinic and supporting it beyond just being volunteers. And so that has evolved now into us having three physicians actually who are involved in the medical management of the Rhode Island Free Clinic. Ross Hilliard is one of our most brilliant young general medicine physicians. He has basically taken on the role of being the medical director. He shares that with Kathleen Whalen and with Melinda Delaney. It's a remarkably complex thing to run a clinic like this. Patients come in, they're diagnosed, their blood tests are taken, x-rays are taken, those reports come back. There's not always the same person who ordered those tests to come and see the results. And so the people that we have that are helping out with the medical director roles serve in that role. I intend to look for other ways to expand our support. There are 45,000 patients in the state who have no insurance. Sometimes when people come, they're not sure what they're going to find. When they find a friendly, warm, and highly competent physician, they breathe a sigh of relief. They know they have a place at the clinic to come to where they'll not only see wonderful physicians, but the entire structure, all of the workers there are really there because they want to be. This is what they want to do with their lives, and they want to serve these patients, and they do it very well. The Rhode Island Free Clinic provides an essential service, caring for patients who otherwise might avoid care, might not be able to get to the hospital, and it provides a wide range of services to the patients that we really need to care for.
We can't thank Dr. Rice and Brown Medicine enough for their outstanding support of Rhode Island Free Clinic and their commitment to improving healthcare for all Rhode Islanders. Another Brown Medicine physician we would like to thank is Dr. Ross Hilliard, our volunteer medical director. As you just heard, Dr. Rice describes him as one of the most brilliant general medicine physicians at Brown Medicine. Through Dr. Hilliard's leadership, Rhode Island Free Clinic is able to provide care to over 4,500 uninsured and low-income Rhode Islanders each year. Let's take a minute now to listen to Dr. Hilliard's story about his passion for providing care at the Free Clinic.
The Free Clinic is a volunteer-based model, so we have close to 200 volunteer physicians and other providers. I help to support them in terms of supporting the system, supporting our EHR, supporting our staff. I also have responsibility for our policies and procedures. In addition, I oversee the group of primary care folks who are there on a regular basis, covering the clinic and providing care to our patients. Started off really working with the medical students. So the medical students from the Warren Alpert Medical School come and do about 2 clinics a month in the evening where they take care of patients, and they get an introduction to primary care and are precepted by volunteer faculty. So I started off doing that, then over time became more connected to the clinic, and then had the opportunity to step into the medical director role. I'm really proud of Brown Medicine's commitment to the Free Clinic. Starting last year, Brown Medicine actually supports 0.6 FTE of physician time at the free clinic, and that includes myself as well as 2 other colleagues to help provide continuous primary care and regular primary care presence. And this means not only do we have regular primary care presence for our patients, but also mentorship and support for the volunteer physicians and other providers who come in only periodically. We do a whole lot of education at the free clinic, and that includes everything from medical students, social work students, residents, pharmacy students. We have psychiatry residents. We really have trainees in the medical professions all across the gamut who come through the free clinic. That brings a whole lot of trainees in, which is great because we have the opportunity to help introduce them to the free clinic, to help introduce them to the values of the clinic, our patient population, and what can be done in a really kind of remarkable volunteer wraparound service or agency. We take care of, at the free clinic, a large proportion of our patients are working poor. They can't afford health insurance under the exchange. They don't have employer-provided health insurance. They're otherwise ineligible for health insurance benefits. And without us, they really would have nowhere to go, or they would have to seek care only in the emergency department, which we know are already overflowing with patients. In addition, without places like the free clinic and our partners and our colleagues across the state, patients would forgo care. They just wouldn't get the care that they needed. Chronic conditions would get out of control and would lead to subsequent adverse effects. I think that's one of the biggest things that we bring for our volunteers is even folks who spend a long day in their office can come to the clinic and be reminded of really why they went into medicine. It's a chance to really get back to their roots and to what they really went into medicine for. And the other nice thing is, nobody's at the free clinic except those who want to be there. So the only people who are there, want to be taking care of patients, want to give back to this community, want to help support these patients. And so you're working with a crew of people who are all excited to be there and are fulfilled by being there.
Thank you, Dr. Hilliard, for all the work you do for the free clinic, both as the volunteer medical director and as a primary care physician. Dr. Rice and Dr. Hilliard provide tremendous guidance and care to Rhode Island Free Clinic and our patients. Their passion and leadership inspires many of our volunteers. I would like to take time to highlight just one of our volunteer physicians, Dr. Vidya Gopinath from Brown Medicine.
The Rhode Island Free Clinic is a great resource for Rhode Islanders, and that as a community that we believe that people should be able to access healthcare, and a big part of healthcare is primary prevention and primary care. Having people in leadership like Ross Hilliard and Lou Rice brings it to the attention of people in my department. Recently, Brown Medicine has supported Ross Hilliard taking a larger role there and being able to provide that kind of continuity of care. I think providing primary care in general in these settings can feel really validating to think about the patients, hopefully not meeting them in the hospital and instead meeting them at the free clinic. I feel very strongly about the importance of primary care, and we have tons of data on how it helps people's quality of life, and just seeing patients in the hospital who are diagnosed with late-stage colon cancer because they didn't get colon cancer screening, or have a heart attack and should have been put on a statin 10 years ago, could have gotten preventive care that would have made this diagnosis not occur. All of that really is something that is lacking for people who don't have primary care, who don't have health care. And so the Rhode Island Free Clinic allowing routine health care for these patients is a huge step towards hopefully improving their preventive care. The Rhode Island Free Clinic is such a lovely space to get health care for patients, for providers, their medical assistants, and the student clinic in particular is really well organized. They're such passionate medical students who organize all these sessions, who set up the translators, who are also medical students. It's really nice being around that enthusiasm and that energy. And for a lot of us, both teaching and practicing medicine are two of our passions. It's nice to see a whole diverse patient population. I feel like being able to practice medicine in all of these settings just makes me a better doctor, and I'm glad that I'm also providing a service to our community.
Once again, thank you to Dr. Rice, Dr. Hilliard, Dr. Gopinath, and all Brown Medicine for your inspiring and long-standing support of Rhode Island Free Clinic. With over 14,000 patient visits a year, we rely on the community partners and volunteers of over 500 physicians, nurses, dentists, and specialists to keep the free clinic up and running. We could not do this without the support of Brown Medicine. With all of these volunteers and patients, you need to have someone who is dedicated to keeping our clinical operations running smoothly. Cruz Martinez is the clinic's practice manager. We would not be able to provide care to the thousands of patients without his leadership. I'll let Cruz take it away.
As a practice manager, I'm in charge of the entire clinical operations, from scheduling 150 providers on a monthly basis, troubleshooting, accommodating, and dealing with either patient complaints and resolving any matters on billing aspects for the patients as well. We provide primary preventive health care as well as specialties. On a daily basis, we provide services to, on a given day, from Tuesdays and Thursday evenings up to 80 patients, meaning it'll be over 120 patients per week. Right now, we have about 150 providers, and on a daily basis for supporting that provider for ancillary services, interpreting, check-in, check-out, and scribes. I would say that is on a given week, it could be up to 47 volunteers at a given time. But there are non-provider volunteers that we recruit as well. And it's a simple process of clicking into the website and looking into how to volunteer at the clinic, follow the instructions that are given, and eventually, once you follow the instructions and the specs that are provided, we'll process your application for any given role. We usually recruit for interpreting, for scribing, as well as check-in, check-out, and medical assistance. We have medical students that are willing to come here to learn at the same time to serve, and they feel like they accomplish something that is significant in their lives, and that's why they volunteer. They truly impacting the community, but at the same time, a population that is in need. The mission of the organization, improving the health of individuals within the community, helping out the most vulnerable population. If you stick to that mission, you will see the impact. It's a saving having a free clinic within the state just to make sure that everyone is treated equally and with respect and dignity, and that's what we're here for.
Thank you, Cruz, and thank you to all my Rhode Island Free Clinic colleagues for your hard work. I'm honored to serve with you on this important mission-driven and humanistically oriented work. Rhode Island Free Clinic operates on an annual budget of $1.5 million with an additional $7.5 million of in-kind health services and medical supplies. Of the clinic's budget, 95% goes directly to patient care and education. Only 5% is used for administrative and overhead costs. This means your donation today is turned into immediate action tomorrow. To talk more about the impact our donors, volunteers, and community partners have on our patients, I'd like to introduce you to our extraordinary Deputy Director, Marvin Ronning.
Clinic is really three things. We raise every penny that it takes to operate the clinic every year. We're very thoughtful about how we spend that money. Clinic is also a volunteer model. We have a very small core staff and a very large volunteer core of medical, dental, behavioral health providers, support volunteers, including Spanish interpreters, medical scribes, medical assistants, and folks who just help out in any way they can. The third thing is we provide clinical care. The thing that's great about the Rhode Island Free Clinic is the people who are the heart and soul, the energy behind it, are the top medical, dental, and behavioral health providers in the state. They're the people who recognize that people need this care, and they're willing to give their time, and they're willing to give their money to support this cause. The clinic only operates because of donors, volunteers, and community partners, and it's really a pleasure to be able to see so much good energy come through the clinic and to the community and the people who really need the care that our donors and partners and volunteers provide. I've been with the clinic for a little over a decade. I oversee three main program areas: the grants portfolio, which is a huge part of the clinic's budget, our AmeriCorps Vista program, which is like the Domestic Peace Corps. Instead of going overseas for 2 years, people serve a year of full-time community service, and I oversee all of our student training. The clinic is actually the home of the Northern Rhode Island Area Health Education Center, and through that, we place over 200 student trainees a year. The benefit to that of students is that they get real-world, hands-on training with patients. The real benefit for the patients is they get tremendous support because all of the student trainees are supervised by faculty supervisors from their programs. Faculty members select the students at the right curricular level to be here providing care to patients. And that's one of the ways that we can advance our mission to be both a provider of healthcare for low-income uninsured adults, but also a training site for healthcare professionals in Rhode Island. I'm here because I believe Rhode Island Free Clinic is a gem for our state. And it really only works because of the power and commitment of inspiring volunteers, community partners, and donors who recognize that there is a tremendous need for the clinic in Rhode Island.
Thank you, Marvin, and thank you to all our amazing donors who make all this possible. If you would like to donate now, please click on the link located below this video. We thank you for your consideration and support. Across our state, over 45,000 Rhode Islanders still remain ineligible for healthcare benefits or cannot afford access. From hospitality and grocery store workers to landscapers and caregivers, our volunteers provide a vital safety net for those who fall in the gap. I'd like to share with you some stories from our patients. Patricia Saldana, Ancleto Perez Grullon, and Margarito Hernandez Gonzalez, so you can hear and see firsthand the impact Rhode Island Free Clinic has on their lives and the lives of so many of our neighbors.
Estamos súper agradecidos y bendecidos porque mediante la ayuda que nos prestan podemos seguir sanos y vivos. Si no, ya hubiéramos muerto. Ok, para nosotros es muy importante porque nos ayudan, nos controlan nuestros problemas que tenemos. Yo tengo la presión muy elevada, ahora tengo la artritis y mi esposo es diabético también y él recibe mucha ayuda, las medicinas, las insulinas. Entonces nosotros siempre estamos agradecidos y orando por esa gente que mantiene la clínica, esas personas que ayudan a la clínica para que siga funcionando con todos sus servicios. Que nunca, como dice, hemos encontrado a las personas de mal humor, los doctores excelentes, los ayudantes, las enfermeras, todas las personas siempre están, aunque tengan sus problemas como también nosotros tenemos, ellos siempre tienen una sonrisa, un apoyo. O sea, la verdad que no hay palabras para describir el servicio que la clínica nos presta.
Me ha ayudado bastante bien y gracias a la clínica soy paciente de cáncer. En esta clínica fue que yo vine cuando me sentí mal y me chequearon y me mandaron para el hospital de Rhode Island y ahí me diagnosticaron cáncer. Gracias a la clínica me pude dar cuenta de esa enfermedad que tenía. Sí, gracias a Dios hasta esta hora, Dios me sanó de ese cáncer. Aquí me han ayudado bastante, que si voy a hacer en otra clínica ya tengo que tener mi seguro y pagar bastante dinero, por aquí cualquier cosita no cobran.
Cuando yo vine aquí al país, me puse malo. Todos los empleados, desde enfermeras, secretarias, doctores, también trabajadoras sociales, buen trato conmigo. Y a todos ellos le doy, la salud mía se la debo a Dios y a ellos. Y también la farmacia, que siempre los medicamentos están al pie de la letra. Bien, al mismo tiempo, ellos no fallan en eso. Mi medicamento, mi todo. Y cualquier cosa, buen trato. Ya a mí me trata como uno, ya como que yo soy de aquí, ya como de la familia.
It is thanks to our donors, volunteers, and community partners that we are able to provide care to Patricia, Ancleto, and Margarito. Finally, I would like to introduce to you Dr. Earl Jackman, who is this year's Dr. Stephen Brin Physician of the Year awardee. Dr. Jackman embodies and promotes the spirit of excellence of the late Dr. Stephen Brin through his exceptional patient care. Dr. Jackman stepped up as a volunteer vaccine coordinator for our COVID clinic, making sure that our state's most vulnerable population received adequate care and were protected during the pandemic. Thank you, Dr. Jackman, for promoting the mission of the Free Clinic through your hard work and commitment to our patients.
I first became involved at the Rhode Island Free Clinic while I was teaching at Kent Hospital. I was teaching the family practice residency program, and one of the nurses there, who also volunteered here at the Rhode Island Free Clinic, suggested that I come here as an avenue to practice clinical medicine and also bring some of those family practice residents here. Once I started working here and realized the good work that was being done. We provide that sense of relief to people that otherwise would have no care, that are disenfranchised, that have no money, no way to get any type of medical care. 15,000 patient encounters, 500 volunteers to help with those 15,000 encounters, 18,000 prescriptions we write at no cost to our patients, 500 physical therapy visits, 500 behavioral health visits, 1,000 dental visits. Just so much good work is being done here at the clinic. I want to be part of it. I've recently been the vaccine coordinator for the COVID clinic. And if you think about it, how scary COVID was for people that had means, that had insurance, that had health care. And you can only translate that into someone who doesn't have any means, doesn't have any ability to get to health care, but yet their family members are sick. They need to try to get to work. They need to try to take care of themselves. They're worried about their children. So it's not like it's just the patient that you're taking care of in any situation in medicine. You also have the mother and the father, the sisters and the brothers, and all the extended family that are all worried, all concerned. We were seeing patient upon patient that was frightful of the system, frightful of getting vaccines, and yet so happy that we're able to provide them some protection for this disease that was ravaging our community. And just with the COVID clinic and the vaccinations that we were able to provide, it was an amazing, eye-opening experience and provided a tremendous benefit for the community on professional and very personal levels. Rhode Island Free Clinic is a necessity for a couple of reasons. One, it's a necessity because it's the right thing to do. And I think we sorely need that today in our world. But also, our patients here at the clinic have chronic illnesses that are significant chronic illness, diabetes, cardiovascular disease, hypertension. If we don't take care of these people now in a preventative healthcare setting, we prevent the stroke that results from hypertension that's uncontrolled. We prevent the heart attack, the myocardial infarction from cardiovascular disease that's uncontrolled. We prevent the renal disease and dialysis and loss of a limb from diabetes that's uncontrolled. The Rhode Island Free Clinic needs to be here. It needs to be here on lots of levels. One, we provide good. We provide good to our fellow men. Number two, we provide a service to the people, to our society. In providing preventative health care, time and treasure is always the key. And we appreciate the time, but sometimes we need some help with the treasure to keep the clinic open, to keep it functioning. And it's certainly in the best interest for every person in our state and in the medical community. The Rhode Island Free Clinic does a great job providing preventative health care to disenfranchised people that otherwise wouldn't have any means of obtaining decent health care.
Thank you again to all the speakers tonight for sharing their stories and promoting the mission of Rhode Island Free Clinic. I hope you have all enjoyed this year's virtual Founders event, which would not have been possible without our volunteers, sponsors, and community partners like Brown Medicine. I would also like to announce that next year's 25th anniversary Founders event will take place on October 19th, 2023. So please be sure to mark your calendars. Finally, I would like to thank all of you for tuning in and hearing why Rhode Island Free Clinic is so vitally important to our state. By contributing your time, talent, and treasures, we can continue to fulfill our mission of providing comprehensive medical, dental, and behavioral health care to our medically uninsured adult Rhode Islanders. Thank you.